All right, good day. You are so welcome to another episode of my channel because it is a great opportunity for us to meet once again in order to dive into the second topic under the differences between cough, cold, and catarrh. And I've explained what cold is all about. So now I'm going to dive into cough. So just follow me and stay tuned and also share in order to help those people that don't have this knowledge. All right. So I believe you people that are watching me, out of 100%, 90 or more than, or 100% have experienced what cough is all about. So cough, there are some people that will ask me such question. And now I'm ever ready to answer this your question. All right, but before you ask me, what is cough is all about? Cough is a reflex action in order to clear the airways of irritants, mucus, or foreign particles. What did I say? I say a cough is just a reflex action in order to clear the airways of irritants and mucus, and so also a foreign particles. So, and we have some types of cough because we have a productive cough and we have a dry cough. Because this dry cough is a is a cough that you will not is just dry, no phlegm and no mucus. But a productive, in the case of productive cough, is a cough that you will be coughing and you'll be bringing out some mucus or some phlegm from your mouth or from your airways. All right. So now, what actually causes this? There are some people that will ask. And I said earlier, there are some people that just interchange some of this medication in order to treat all this cough. So now I'm going to explain what caused this. And from there, you'll be able to know, so which medication are you going to recommend? That is for health providers or for pharmacists or for doctors to know the drug that you recommend to a patient. And now, I said earlier, is an educational health tips. So what causes this is an infection. It could be a viral infection and it could be a bacterial infection. Can we see a slight difference between the cold and the cough? A cough can be caused by a virus and can be caused by a bacteria. But cold cannot be caused by a bacteria. It can only be caused by a virus. Okay? And what can cause this cough again is allergies. Allergy, asthma, and acid reflux, and even smoking. When you smoke, so it will irritate some of the airways, then you will not be coughing. And now let me just talk about some of the symptoms that when you see or you identify them, you'll be able to know, okay, which drug do I supposed to use, or which drug do I supposed to recommend to so person that is coughing. Okay, just take a look of these symptoms. Just take a look of this or listen to these symptoms. All right. So now there will be a persistence coughing, a persistent cough. That person will just be coughing, and there will be a chest discomfort. You know, the chest, because of too much of cough, the chest will be having some discomfort in the chest. And so also there will be difficulty, that is in severe cases, there will be difficulty in breathing. Difficulty breathing. That person will not be breathing too well, because there's an obstructions in the airway or the pipelines. Okay? So now, how can we treat, or how can we treat this cough? But in any treatment, we have what we call first line treatment. And today I'm going to share just the first line treatment. Okay? So if you have any, or if you have any question, you can just put it at the comment section, so I'll answer you. All right, in time of treating this cough, you have to differentiate between the productive cough and the non-productive cough. You understand? That is the dry cough or the cough that you are bringing out from phlegm or mucus. Now, in terms of dry cough, let me explain in case if it's a dry cough you are battling with. In terms of dry cough, you will need a cough suppressant. This cough suppressant, like dextromethorphan. This dextromethorphan actually helps in order to have a relief from that cough that you are coughing. Okay, so just then in terms of this productive cough, the cough that you are bringing out some mucus or some phlegm, so you will need expectorants because you are bringing out mucus. You will need expectorants. Okay, so needing that expectorant, it will help in order to lose, or it will loosen all the mucus that you are bringing out. Okay, it will lose them. It will lose them. So when it lose them, you'll be able, when you cough, you'll be able to bring out all the mucus. Because being that mucus obstructing that your airways, you will, that cough will continue because of that blockage of that mucus. All right. So now another thing is, because under this expectorant, we have guanfacine or guanfacine as guanfacine or guanfacine or guanfacine. You can call it that way. So it's one of the example of this expectorant. This guanfacine is very, very effective in treating a productive cough. So because it loosens those mucus that you are battling with, because that mucus, if that mucus is still there, so that cough will not go. So you just have to take note of this. And another one is hydration, because you have to be dehydrated. You have to be hydrated and also have some humidifiers. Having this hydration and some humidifiers will actually help in times of this productive cough, because this, it will help in order to soothe the throat. It will help in order to soothe the throat. You will not be having some, and that is why some people will be coughing. They'll be having, they'll be battling. They will say, please give me a drug for sore throats or so on and so forth like that. So it suits these humidifiers. It suits the throats. Okay, it helps in soothing the throat and also avoid some irritants. Avoid some irritants, please. Anything that you know when you take them or you drink, it will irritate you. You understand? It will make you to feel somehow. It will make you to be coughing. A persistent cough or a cough that will just for a while it will go. Please avoid them. Such as smoking. When you took a cigarette, um, or less for those that are used to eat. Even for them, it's not advisable, please. Because when you take them, it will irritate you. It will irritate some of the airways. Okay. So now, need help. Please, you are in need of help when the cough persists for more than few weeks. If you take medication, they say it will just subside and it will come back. You took some medication again. You are by just squandering the whole money that you have, and the thing is still there. So you need an assistance. You need a medical help. You can just consult your physician or consult any of your doctor in order to recommend a good drugs. But sometimes, you know, we do have this problem. This problem that I'm talking about is self-medication. Self-medication. You don't even know which medication that if you take, maybe, yeah. Some people don't even know the differences. You don't know the difference between productive cough and non-productive cough. Then you will now be recommending some, having some self-medication. That is not, please, is not allowed. Despite the fact that most of them are over-the-counter drugs, but still yet you need help. You need what? You need help. So if this cough persists for more than some few weeks, or the cough, it produces blood, or is accompanied by difficulty in breathing, yeah, you are not breathing too well because you are feeling somehow in your lungs, your chest. So please, you need help. You can consult any of your physician. Thank you very much. Just stay tuned. Always, I'll be posting some health tips. Just share. Don't be selfish. Continue sharing in order to reach those who are in need of that. And by the special grace of God, your life will never remain the same. You may have, some changes. Thank you. Thank you. Thank you. Okay. And all right, just stay tuned for me to talk about, because I've said a little about the cold, the cough, I remain the catarrh. Thank you very much.